When choosing to use an advanced airway, you need to be confident that it is inserted correctly and that you are providing effective ventilation while avoiding excessive ventilation. Watching for chest rise, checking for bilateral breath sounds, and listening for gurgling sounds coming from the stomach can help you confirm the placement of an advanced airway. Beyond these clinical assessments, there are several devices that can help you determine whether you have inserted the airway correctly. Waveform capnography is the most reliable and quantitative method for doing this. Waveform capnography monitors the amount of carbon dioxide exhaled by the patient. It's the most reliable indicator of endotracheal tube position during cardiac arrest. It also serves as a physiologic monitor that provides information about the effectiveness of chest compressions and the return of spontaneous circulation, or ROSC. The American Heart Association recommends using waveform capnography as a way to confirm and monitor the placement of an endotracheal tube. Scientific studies have not yet validated waveform capnography as a method of confirming proper placement of supraglottic airways. However, effective ventilation through these airway devices should produce a capnography waveform. A normal carbon dioxide or CO2 waveform looks like this. The measurement of the amount of carbon dioxide can be shown as a waveform, where the carbon dioxide level goes up when we exhale and falls back to zero when we inhale. Even when the healthcare providers are properly ventilating the patient, ineffective chest compressions will produce a low end-tidal CO2 reading. In contrast, ROSC can cause an abrupt increase in end-tidal CO2. Another type of CO2 detector, the colorimetric end-tidal CO2 detector, simply changes color when it detects CO2. Although this can be helpful to confirm the placement of an advanced airway when waveform capnography is not available, studies indicate that these devices are no more accurate than watching for chest rise and other clinical observations. One additional confirmation device is the esophageal detector device, or EDD. The EDD is a bulb that providers compress and attach to the endotracheal tube. If the tube is in the esophagus, then the bulb will not expand and fill with expired CO2. Another model is a large aspiration syringe attached to the tube. If the endotracheal tube is properly placed, providers will have no difficulty retracting the plunger. Esophageal placement will prevent plunger movement. Studies show that these devices are no more effective for confirming tube placement during cardiac arrest than clinical observations that include chest rise and bilateral breath sounds. Airway skills are fundamental to successful ACLS. Proper training, frequent practice and use, and logging both successes and complications can help build your skills and lead to more comprehensive, successful patient care.